really went into healthcare and focused on the healthcare architecture piece because of my dad. My dad was very ill my last year of college. He had a liver transplant. And you really think about that experience and what it does to you. I mean, even the noise and the sound in the space, all the alarms of, going off for people's heart rate or blood pressure or whatever they're listening to. I really thought that after that experience of being with my dad, I could make a change. So in 2012, my family and I decided to go to New York City for spring break. The last night before we left, my son actually got really sick. To the standpoint that I was a little bit worried about what was going on with him. And the next morning after that, my daughter just felt horrible. She just had a constant stomach ache, couldn't go to the bathroom, just, was not having a good time. So we started to try to go home, and every hour we were stopping with her because she just felt really sick. There was something wrong. It wasn't just, a cold or a virus going on, something was wrong. I got Ashley to the hospital, went into the pediatric ED. First thing is they took her temperature, and her temperature was 104. And through the night, Ashley started getting sicker. Her heart rate kept climbing, and that was because her temperature was so high. So at that point, they decided they needed to make a change. She was then intubated at that point. Her organs were failing because she had toxic shock, basically. Ashley was intubated for 10, 12 days. During that time, we had to figure out how to be a family and how to just keep functioning. As a parent, when you look back and you start to think about all those things, which I did repeatedly every day, you really wonder if she was in the right place or if things could have been different for her or better for her in a different space because of, the concerns I had with staff walking in and out, how stuff was stored. How would you make it better? How could you make the experience better for the family, for the patient, and for staff? After 10, 12 days, Ashley's fever broke. She was breathing on her own then at that point. And the first words out of the mouth was, "I want candy." I've spent a lot of time in the hospital, not designing hospitals, just with family members being ill. And, through those experiences, you really understand and you learn about what needs to happen in design in a facility. It's not architecture, it's just really having that care and understanding of those simplistic items that patients and families need. CPL has always challenged me and provided me an opportunity to grow as a person and as an architect. I love the projects we do. I love, moving forward and expanding our healthcare market. My role today is to look at the bigger picture. So really understand what that means to patients, staff, and the community from the standpoint of access. We don't want to look just what's inside the box, but what's outside of it too. One of the best projects I got the opportunity to work on was one of our biggest at CPL, and it's the Sand Constellation Center. So that building provides the hospital with the opportunity to put 108 very sick patients into private rooms and let families stay with them. It also, during COVID, allowed the hospital a place to put all their COVID patients away from other patients in the hospital. And with the functionality of being an intensive care room, it provided them with the air changes and the equipment and negative pressure rooms to help with those patients during COVID. That project allowed us to have opportunity to design what we've been working on for 10 years, which was really, patient rooms that, we got to include all the items that I've gone through in my life and looked at, opportunity for families, for patients, and for staff to have accessibility, places of comfort, places of respite. I really had the opportunity to apply everything I learned and went through in my experiences with my dad and my daughter. One of the biggest payoffs I see is when you see a patient come out of a facility healed and healthy, or even just happy about their care that they received. That's the greatest experience you can expect. I'm Trott, and I want to design spaces that promote wellness for you and your family.